exposure to loud noise, if it happens frequently, it can affect the hearing significantly. According to the WHO numbers, it's been estimated that about 5% of the total population in this world, it's complaining from disabling hearing loss. And 5%, it seems like a small number, but it's almost 350 million people. And we don't mean the total number of hearing loss, that's the disabling hearing loss. And I mean by disabling, it's an hearing loss that needs intervention or needs hearing aid, surgery, some sort of intervention because they are really suffering. Deafness usually means disabling hearing loss. I mean hearing loss that can affect the quality of life. They cannot live normally within the community with this hearing loss. But hearing impairment can be mild to moderate degrees that just need follow-up, that doesn't really interfere that much with the lifestyle or with the quality of life, but it just needs follow-up. When we talk about causes or different causes of deafness, we need to categorize the patient throughout his life, starting from being intrauterine, so some infections that can happen during pregnancy like rubella, cytomegalovirus can affect the hearing. During the birth itself, if she's having problems, low oxygen saturation, things like that. Immediately after birth, if the infant suffering from high bilirubin levels can affect the hearing. Many early childhood infections, high fevers can affect the hearing. Preschool age, again, many viral infections can cause that. After school or the adolescent period, a lot of medications can affect the hearing. Noise exposure can do that. Many diseases that can affect the hearing in the external ear, middle ear, or the inner ear can do that in the adolescent or adult life. And we have a very common cause that aging can affect the hearing by the process of presbyacusis, that the nerve itself becomes more stiff or the cochlea becomes more stiff. So there is usually a high frequency hearing loss, which is called presbyacusis, affecting the hearing. If we're expecting exposure to loud noise during social gatherings in some places like airports and the malls, streets, things like that, it's better to protect our hearing by earplugs or any other sorts of hearing protection, because exposure to loud noise, especially if it happens frequently, it can affect the hearing significantly. First of all, we need to know the different causes throughout our life, and according to the different age groups, we can protect our hearing by immunization during childhood, taking care of the mother during pregnancy, taking care of the medications that we're taking, the noise that we're exposed to. Immediately after the complaint of hearing loss, even mild, we need to go to the doctor to check our hearing for early management and diagnosis and treatment.